Well, the reason I'm here today is very simple. I was in the right place at the wrong time 6 months ago. We call ourselves the Band of Brothers. We're having these napkin sessions, and we were talking about exactly what Mike was saying, that I think there's a crisis coming, and somebody needed to do something, whether it's an individual or an organization. And I said, Mike, you ought to find a sucker that gets up there and talks to somebody about this in the next meeting. And he goes, oh, we have somebody. He said, you. So I don't know if it's my friend or not, but this is, so the question is, what makes me qualified to talk to you guys about this? I'm an interventional pain doctor. I'm not a JD. I'm not a ethicist. But what makes me qualify, you guys are qualified to this, is like, listen to the lectures this morning. This is phenomenal. The group of people, the class, Mayor talking about, the approach to this disease, the science, go at your own pace, you know what? And Dr. Eck about the accurate diagnosis, and Dr. Brown, his passion to find the right treatments, okay? And then you see what's going around us. And unfortunately, it didn't take me too long to research this, I have to tell you. And what I saw, I didn't like. So I'm not here to preach, we're better than anyone else. This is designed to be thought-provoking, okay? I will start with some really basic definitions of things that you probably know, but it kind of makes this more complete. So quickly, of course, no disclosures. Here, so the first thing is this, what is the practice of medicine? Interesting, because every state has their own different definitions of what it is, okay? And when you practice regenerative medicine, you better, look at your state regulations, because they'll tell you exactly what you can and can't do, okay? So it builds down to here, if you try to diagnose, cure an illness, prescribe drugs, perform surgery, or claim that you're a doctor or a physician extender, well, here, that's one of the definitions. What is medical advice? Okay, we all struggle with this. Your office staff answers the phone, and somebody wants to know what you do, and that's medical advice. You got to be careful what happens. So here, you provide a formal professional opinion regarding what the specific individual should do or should not do. Okay. Regenerative medicine, I just want to mention this. It's multidisciplinary, but it's multi-specialty. We are not the guardians of the Holy Grail, okay? Everybody carries this. So, but it's just designed to induce changes that lead to tissue repair. The concept of regeneration, I struggle with that because I can't prove that I regenerate too many things in my practice, but they get better. So what I try to do is, repair some tissue, and a lot of times that will become a liability later on. A lot of us do tissue engineering. It's not inflating a disc or balloon. You have to mix different substances. And this is a definition of tissue engineering. So I'm going through the concept. Interesting. What is the legal system? Okay. So it's a system of rules, okay, that every country or community has, and it regulates your actions, okay, and it might enforce penalties. What is legal? Well, here, a set of behaviors that are permitted by law or recognized rules. What is illegal? Interesting. Okay, so it's, you could debate this, and if you have the friends that I have, we'll go after it for 10 hours and no one figures out what we talked about before. So here, it's a violation of a statute, okay, which may be criminal or not in conformity. So an example of an armed robbery, it's illegal, okay, so is, an access to a road which is narrowing, and so, but one is criminal, the other is not. So we live in an area that it is definitely between what's legal and what's ethical. So this is going to get more interesting. Let's go through this, really quick. So basically, medical ethics, everybody feels what ethics is, and some people have to define what ethics is. So it's just, again, it's a system that determines what's right and wrong based on beliefs, okay, and the duty to others. What's ethical? Well, you have to be in accordance with the accepted principles. So what happens? Well, who decides that here? What is unethical? Well, you're not conforming. And this is a very great area because everybody has an idea of what's ethical and what's not. Now, this is very interesting. Who determines what? Well, usually, unfortunately, the judicial system tells you what's legal or not, okay? Your state medical board usually tells you what's ethical and what's not, okay? So this is where we live in regenerative medicine. Has anyone applied for an IRB and you take the internet course, the CITI course? If you haven't, that is phenomenal. That's the foundation of ethical ethics. Is a beautiful course, and I think everybody should take it. In fact, if you do an IRB, you're forced to take that course. So, so the four basic principles of what we do: autonomy, justice, beneficence, and non-maleficence. Meaning, number one, autonomy. You could read what's there, but it boils down to this. It's like the patients can be coerced into anything, meaning that you can't tell the patient, hey, I could put a little steroid, but you really should have the $20,000 procedure of something that I just cooked in my lap yesterday, okay? It's just like, you could really bend the rules, but everything is subject to interpretation. So justice, self-explanatory, but I would like to talk about it's the most important part that sometimes we struggle with this because we know that third party doesn't pay for what we do. So it has to be something that is distributed equally among all groups in society. I struggle with this every day. You know, when I did third party, the insurance company would pay for everything that doesn't work, and I could really, treat everybody, go home feeling great in a certain way. But when you start doing regenerative medicine, it's not distributed equally. This is something that we all, I did an introspective review of myself, my practice, and the organizations that I belong to. And this is something that we had to think, maybe the time will come soon that we treat everybody, but there's a principle that it's steering us. Beneficence, well, you had to do good in your intentions, okay? You had to develop and maintain skills, knowledge, continuous training. This is what we do. This organization has an incredible training program, better than most of the organizations that I belong to. I came from the interventional medicine world, and I belong to multiple organizations, and this is by far my favorite. The people here are great. They all want to do great for civilization. They're very intuitive, and I feel very at home in this organization. So unfortunately, there are other organizations that promote different ethical standards, and they feel very at home too. So, analyze yourself and see who are you hanging around with. Your parents tell you, I don't like the group that you're hanging around with. But this happens in the professional level too. So the fact that no malfeasance, okay, here, do no harm. This is very, very self-explanatory. Well, let's go back to the Hippocratic Oath, okay? He was a philosopher, but he sort of like set the pathway in terms of what we should do, and a lot of us in medical school, and frankly, I don't remember, I think we did have the Hippocratic Oath, but if you look at it, it's very simple. Does it encompass everything we do? No, absolutely not, okay? It's like, but I don't recall reciting this. I was sober that day, but, it's just... It's called cognitive dysfunction. But anyway, but it was designed for a purpose. He wanted to guide the practice of medicine in the right path. I read a lot of articles. It's very interesting. I have no idea that doctors were questioning whether this was obsolete or not, okay, or whether it needs to be updated. It's like, and is it enough to protect the physician, or should it be replaced? These are all questions that are circulating in medical societies all throughout the United States and the world. This is definitely a surprise to me. So some medical schools have different types of oath. The British try to change that, create their own version. It was not accepted, but that shows that people are already looking into maybe we should update this, maybe we shouldn't. And that's something that we did debate for generations to come. This is one of the most important documents in the history of modern medicine, okay? It's like, after World War II, we were in chaos. We were horrified by what some doctors did, the trial in Nuremberg and the Unit 731. This was atrocious crimes committed by physicians, okay? In the world's in turmoil, And something had to be done. And I go to the next slide. This is very interesting what I found out. So what's our emblem, okay? Is this our emblem? Most people say it is, okay? Well, I got news for you. It's not, okay? You know who Hermes was, right? Here, it's the god of transitions and boundaries and moves freely, okay, from the worlds of the mortal, the divine, and guides departed souls to the underworld. I think that some of us are practicing that way, okay? Is this who we are? You decide, okay? So I'll give you choice B, okay, the staff of Asclepius. Now, if you talk to Brian Scheipel, he's a smart guy. He always tells you here. So he said to me, the DOs have that, okay? And of course, he's right, but I said, why? What do you mean? Why do you have that? Well, he didn't know, and I didn't know. Okay, so who is Asclepius? A lot of you guys know who he is, okay? I mean, I don't know him personally, but here, you know, truth, he was the son of Apollo, the god of healing, okay? And his daughters, Hygeia, okay, the goddess of hygiene and cleanness. If you have teenagers, there's no goddess of hygiene and cleanness, okay? And then Panacea, the goddess of remedies, okay? So why the controversy? Interesting. My son-in-law is a captain in the Army, and I love, by the way, any active duty, ex-active duty, military service in the audience? Thank you very much for your service. So anyway, so here, you could read this is incredible. So this captain confused the emblems, okay? So typical of our government, you know, they figure out that it was the wrong emblem, but they decided it was too late. It's been used for 4 years, so let's confuse everybody for the rest of civilizations, okay? So that's it. So how does it apply to ethics? Well, you gotta pick up which emblem you want in your office, okay? So, and that's up to you, okay, for what it means. It's like, this might sound corny, but I think it pertains to how we practice medicine. So interesting. This is describes regenerative medicine. Have you seen this before? The stages of truth. Isn't this incredible? You know, when we started doing this years ago, you know, we were ridiculed, and then everybody opposes us. You know, here there's no way that could happen, and pretty soon it's becoming self-evident in what we do. Okay, Hippocrates was the first regenerative physician. Here, man, how simple can this be? Okay, what? 2,500 years ago, it took this long to figure this out. Anyway. So here, this is the gist of this. I'm going to mention certain things and show some examples that are public documents from the internet, okay? I'm not incriminating any companies here. And Mike Brown, so you could feel better, I have to do a disclaimer that the opinions presented by myself do not necessarily represent the AAOM or anyone else in this room, okay? So if you get that, that's okay. This is going to get very good. Okay, so here, why do we have these problems? Here, we don't have a good animal model, okay? So everybody that comes with a new miracle in a rat or a rabbit, it's just like, have you ever treated a 35-year-old diabetic, you know, offensive lineman rabbit? I haven't, okay? So here, what I can tell is that here, humans are 90% rat, so you have a 90% chance that it's going to work on you based on the rat model, okay? Is that what we tell our patients? I don't know, you know what? Consensus. It's like if you have two doctors in a room, there's no consensus. Simple, okay? We have to get together to create consensus. Okay, here, there are some institutions that point their fingers at us because of lack of credibility. You know what UCT is? Have you heard that term before? Unknown cell therapies. So I came, when I did my conversion to the dark side of medicine, regenerative medicine, 12 years ago. I joined the Cell Therapy Society. It's a great organization, fantastic researchers, and I did the Termis, which is a tissue engineering society, and then I did the IFATs. All those guys, they are creating different things that we see down the line, okay? They have certain terminology that they use, so when they talk to each other, they don't get confused, okay? We are stretching that terminology big time. I know we do it, and it's not intentionally to deceive anybody, okay? But we have to talk the talk, okay? If I am going to communicate with Dr. Moyer or Dr. Keebler, and I said, hey, I'm doing stem cell therapy, their answer is, I didn't know you have a lab to expand cells. because for cell biologists, the stem cell therapy is when you expand cells. It's a one cell line, okay? For us, it's not. It's like, I call it biologic gumbo. We have a gumbo of cells, okay? That's it. There are stem cells there. Does it work like stem cells? Yeah. Can we make an assumption of everything we do is a stem cell? Absolutely not. There are 8 or 9 other cells that are not neutralized by a bone marrow or SVF, okay? So when you hear in a publication from the ICT or the Termis, adipose-derived stem cells, they refer to stem cells expanded in a lab that came from adipose tissue, not SVF. Now, the IFATs and the ISCT came out with a joint statement saying that SVF, it's stromal cells, not stem cell, stromal cells. So isn't there in the right path? They tried to define what is it, what should we call things, okay? So if you ever go to court and they get the president of the ICT and said, what do you think of how he calls what he does stem cells? Okay, well, the overwhelming majority doesn't do it, okay? So I'm not preaching, I'm just saying that we had to recognize that there are 2 different languages, and we had to work on that, okay? Lack of proper education, not in this organization, but it's rampant, okay? Deceptive promotion of therapeutic efficiency and tools, running rampant. Physicians practicing out of the scope of practice. We have a pulmonologist in our town that goes to a weekend course, and he became a overnight stem cell sensation, okay? He's a stem cell doctor. No experience whatsoever in musculoskeletal medicine, but he's smart enough, he knows that he can't kill anyone that way. So here, we had to fight this, you know what? Deceptive advertisement. I'm gonna show you something pretty soon that somebody's looking heavily into this. And physician bias, conflict of interest. If you have your own company, you produce your own cell concussion, and your results are exaggerated, we know who they are, okay? That is conflict of interest, okay? So you have to be very careful about how you interface with the rest of the scientific community when you are heavily involved in your product. Here, lack of safety and efficacy studies. How many times someone comes to you and they have early to moderate arthritis and they ask you, well, doctor, what's the best treatment? It's like, heck if I know. You know what? It's just like better than steroids, but it's like we need to do comparative studies. If you say that BMAC is better than PRP and fat graft, prove it, okay? If you mix IGF with Hyalgan and you get great results, let's compare this, okay? This is high school locker room talk, regenerative medicine. Let me explain myself. So you're in high school, you're full of hormones, okay? And you're in the track team, and you tell the next guy, I'm faster than you are. Baloney, I'm faster than you are. Oh, no, I am the fastest guy. Let's go to the track. Why? This is who we are. We don't want to go to the track, because what about if an old Toyota beats a Ferrari? You know, Ferrari has some explaining to do. You could have 50 Toyotas or one car, okay? This is it. We used to think that expanded cells were the ultimate in medicine. I can tell you this, look at the DISC study. If you compare the studies on PRP, the studies on BMAC, and the phase 2 trials of Mesoblast, PRP and BMAC is as good as Mesoblast, expanded cells, okay? Here, they will never do a study comparing their product because it'll bankrupt the company. So what's happening when they finish phase 3 and someone approaches, hey, this company wants to sell you something for $35,000 a pop, it's like, send me 20 samples and I get you guys involved in the study, and they go out of business right away, okay? It's not any better because it's our patient selection. So unless we do comparative studies, we will never have answers to our patients. If our patients are financially drained, and you say, here, this is a procedure for $4,000, this is one for $2,000, and one for $800, I really think you should go for the $4,000 one, and the patient has to sell the car, and you can't tell them that it's better. Now, you broke all the rules of humanity, okay? You quit being a doctor, you're a businessman. So I'm just telling you, it's just the way it is, we don't have that publication. You know, I tell the patients, I will do this because I will talk the CEO or someone to give it to me for free. but you're not going to get anything for free here, okay? Well, sometimes I do a little charity work, don't get me wrong. But so the rules that apply to me doesn't apply to the patient, okay? The other group of cowboys that they think that the FDA is a theoretical organization, that nothing they do, have any kind of power. I got news for you. They do, okay? And if they tell you that your product is a 351, and all you can say is, well, I disagree with the FDA. Okay, go ahead, disagree with them, okay? They like to use the Federal Trade Commission to enforce what they do. So you have to respect the rules. This is who controls us, okay? And the second that you do a 351 procedure more than minimum manipulation, and you have a bad complication, okay, now it's time to start looking for your expert witness that are going to redeem you, okay? I used to do SVF. Anyone from the FDA here, by the way? No? Thank you. Rumors has it that I used to do SVF till recently. I don't anymore, okay? I have to admit I was one of these persons. I think, hey, they have bite, okay? And we have to respect that. Improper informed consent, incredible. You have to tell the patients that there are options out there. You just can't treat. If we call this personalized precision regenerative medicine, there's nothing personalized about putting BMAC and a fat graft on every person that walks into your office, okay? This is just my personal opinion. I don't like to offend anybody, but this is regenerative medicine. So if you do that, you basically dispute the existence of DNA, okay? So this is just my take on this, okay? Be personalized, okay? This comes back later on to haunt you, and I'm going to give you some examples. There's a lot of public mistrust right now. It's incredible. We are sinking, not because of what we do, because of what the unqualified people do. And also, the lack of predictive tools. We need to do a better job. We create our own, tool system to predict outcome. But what you have to tell the patients, in our practice, we have excellent chances, good, average, and Hail Mary pass. They all know what a Hail Mary pass is, okay? Meaning, I'll do it, but chances are it's not going to work unless you have Aaron Rodgers in your office. I could throw a good one, okay? So anyway, here, this is where we practice. There are things that are legal and unethical. I'm going to give you some examples. You can or not disagree, that's okay. So legal and unethical. And these are all not theoreticals. I could find 50 websites right now with this, okay? Stem cell company, what I mean by that is like stem cell treatment centers of whatever XYZ, I don't care who they are, okay? That they advertise the use of BMAC, okay? And they treat everything, okay? Chronic constipation, ALS, autism, you name it, bad marriage, it doesn't matter, it'll fix it with what you have, okay? It's just like, and when you look at the research backing, okay, their assumptions, it is bone marrow-derived mesenchymal cells expanded in a lab. Most people don't understand the difference. They say, wow, look at all this data. This must be really good. No, it's not. What you do is not ex vivo expansions of mesenchymal stem cells, okay? Now, I'm going to show you later on how this plays into this, okay? A physician charges $40,000 for a treatment, okay, that is completely ineffective and doesn't tell the patients that for $1,000, I could give you something significantly better, okay? Here, is it legal? Yeah, the two parties agree to the price, services were rendered, okay? Is it ethical? You decide if that's ethical or not, okay? In our office, if I have someone that's very wealthy, I overcharge them, but I tell them that goes for a slush fund, and they will be responsible for the treatment of somebody without money. And I have yet to find someone that says, no, I don't like that. So I tell them up front, I'm going to charge you another $1,000, okay? And if you really want to grow your practice, send them a letter saying, I just treated a patient, and he did fantastic. Thank you very much for your donation. Next time you see them, they'll give you $2,000, okay? And then the same thing. If you use a very invasive intervention for something that could be very simple and you have a complication and you have no data to support what you're doing, good luck, okay? Everything is legal, questionably unethical. What's illegal and ethical, okay, here. So you get cells expanded in Texas. and inject it in somebody, okay? The FDA says that's illegal, but it's ethical because you wanted to cure the patient. If there was nothing else you could do, same thing. We all struggle with piggybacking procedures. Well, rumor has it that I've done that in the past. I decline it. I deny it. But the reality is this: we all try to help people. If they don't have any money, we'll try to find a way to put small print in the medical record that you drop in PRP or platelet-derived growth factors or whatever you call solution X, okay, to help them. Okay, is it legal? Absolutely. The insurance company changes the definition of what's legal all the time. But you have to make sure that you know what you're doing, okay? These are examples of analysis of conditions. Okay, what's illegal and unethical, okay? Here, when a industry tells you that their product is FDA approved or has a 510K, okay, and that is minimally manipulated and it's not, okay, so it's definitely illegal, disseminating wrongful information, and it's unethical to tell you that, okay? So you could see the trend. In my practice, I tell the patients that if they want me to cure the discogenic pain with 3 epidural steroids, I tell them it is legal and it's unethical for me because I know that you have 0 chance of getting better, okay? It's not going to change anything. I refuse to do the procedure, okay? Now, I don't want to be harsh, but if you go to a doctor and you said, hey, I have this condition, what can you do for me? I said, well, listen, I'm going to do a procedure that potentially could damage you. You have to pay me, and you have 0 chance of ever getting better. Would you do it? I mean, you have to be realistic, okay? So, that's something that we all struggle with, okay? And sometimes you can say, well, but that's a Hail Mary pass. Okay, I buy it. Now, if you have a nice anniversary cruise and you have a bad knee, and you say, I want to dance and have a great time, sure, let me pump you up full of steroids, okay? I have no problem with that, okay? But they know that this is a patch. This is like a pain shot. Here, take Lortab, which I don't prescribe. But they have to know, okay? This is what's going on right now. Has anyone here gone to a stem cell seminar? Okay? Incredible. It is. There's a company in Dallas that did like 11 seminars in 3 months, okay? And I went because one of my patients and friends invited me, and I promised them not to embarrass them. This is unbelievable. Are you aware that everything anyone does here doesn't work? That there are some cells from amniotic tissue that rule the world, and if you inject that in somebody and you break your bones 10 years from now, those cells will create new bones, okay? This is it, okay? And it's $5,000 for the treatment, but in the next 60 seconds, okay, if you commit, I'll give you 20% off, okay? 60 seconds, and it goes like this, okay? Now, this is what my patients come to. I like that because it creates awareness of what we do. And I tell the patients, this is what we do. So these are the false prophets there. In every town, there's a chiropractor, an extended provider, and a physician involved with this, okay? I'm not blaming chiropractors, okay? There's always a physician behind this, okay? So here, we are in critical mass right now. If you see that publication, we've arrived, okay? Here, it's like, so if you think that nobody knows about this, I got news for you. Anyway, so again, this is public information. I'm telling you where we are right now. Class action lawsuits. When have you heard that there are class action lawsuits against doctors' practices, okay? Here, concerns over stem cell clinics causing blindness, okay? 3 cases, all right? 3 cases. And everyone knows here how this happened. This is the company involved. I'm not pointing fingers. I'm just reporting something that appeared in public information through the internet, okay? And this is part of the article, okay? Was sued along with other defendants by former customer Elizabeth Noble, right? An experimental stem cell treatment for vision. Now, since this was SVF, they call it stem cell. Now, all the academic doctors and real stem cell physicians are and PhDs are very upset because that definitely puts a dark veil on what they do, okay? It's just like, now, so this is how the industry, not all the industry, will fight back at a bad review, okay? Another one, FDA warning letter. This is a warning letter. You know, the FDA sends 3 letters: on title, warning, and cease and desist, okay? Here, not only the Irving stem cell treatment, but the Lung Institute in Tampa. And this is just very simple. It's all over the internet, okay? Is it possible that a growing number of lawsuits against stem cell clinics could freeze or reverse the growth of the clinic industry, okay? If so, the lawyers can do what the FDA can't do, okay? So we got 2 things that we fear in this society: what the government can do for you and what the lawyers can do for you, okay? This is where we are right now. It's not pretty, okay? The press, California law firm advertising potential class action suit, okay? I had dinner with somebody in Dallas that is preparing to launch a campaign about if you have had stem cell treatments and the outcomes were not positive, call this number. It started, okay? It's out of the gate. And I'm telling you that because it's terrible, okay? Again, another one was Stemgenics, okay? This is, I mean, public information. Just Google that. It's just like, these are the charges, okay? They charge you $30,000 for that document, and then you go happy until you get your first class action suit, okay? So here, the FTC doesn't believe any of that. If you have it in your website, it's for a reason. They can see through this, okay? You can say, well, if you read my disclaimers, that doesn't hold water. This is out of Dr. Knopfler. He's a scientist. I don't know who knows him or not. I don't use Irvin. He has a nice little blog. I haven't shown you the rest map of the United States, but the FDA taps into these blogs, okay? This is just a certain part of Southern California, okay? And when you have time, go to his blog if you want to know if your name is there, and you might or might not be surprised. Okay, so what can we do as an organization, okay? So anyway, comparative research, encourage your members to tell the truth, promote practice evaluations and the standardization of protocols. We had to police ourselves, and we had to be the vocal minority if we want to preserve the rights that we have right now. Anyway, this is self-explanatory, remove speaker bias. These guys are doing a great job in this organization. And I leave you with this because this is the response of the world to the atrocities of World War II, okay? And I got kind of emotional when I saw this because it brings you back to who we were once, okay? And I have a copy of this. It's what we should be as doctors. And if you have time one of these days, recite it in front of the mirror and say, here I go, let's help humanity again. Listen, that's all I had to do, and I hope you guys enjoy this presentation. Thank you very much.